Hi, I'm Dr. Steve Myers, and I'm here with my patient Patricia, who is 3 months out from a bilateral knee stem cell procedure for bilateral knee arthritis. Not only did we do a stem cell procedure on both of her knees, but we also did intraosseous PRP injections into her left knee for some bone issues where she had some arthritis issues going on inside of the bone. Before we talk to her, we're going to take a quick look at her imaging studies. Okay, so looking at her x-rays, this is a standing AP looking at both of her knees. This is her left knee and here is her right. And you can see that she has bone-on-bone appearance, severe arthritis going on in both of her knees. There is no cartilage left on the inside of both of her knees. Also, she has these bulky bone spurs, which are part of arthritis. Severe arthritic change, bone-on-bone disease in both of her knees. And on the MRI, you can see that she has got some good cartilage space on the outside of the knee, but on the inside, she's bone on bone. There's no cartilage left. In addition, she has these bright changes going on in the bone on both sides of the joint. And these bright changes are areas of fluid, swelling, inflammation in the bone, weakened bone, arthritic change occurring inside the bone itself on both sides of the joint. You can also see these bright changes on the sagittal images, these bright changes at the bone surface above and below the joint involving the femur and tibia on both sides of the joint. So to affect these bone lesions where you have arthritis occurring inside the bone itself, we have to inject directly into the bone. We use PRP or platelet-rich plasma for these intraosseous bone injections to affect the arthritis inside the bone. So what that looks like is injecting into the femur. Here you can see my needle going into the bone of the femur and also into the tibia to inject directly into the bone to get a healing response for the arthritis inside the bone. Don't worry, you're asleep for these injections. Okay, so here we are 3 months out from procedure. Let's go back in time. Tell me about your knee issues. What were your knee symptoms? How bad were your knees before we started treatment a few months ago?
They were real bad. I had to walk with a cane because it was so bad. I couldn't really climb stairs. I have to take them one at a time. And the left knee just wouldn't really cooperate. I had to lead with my right knee all the time. And very painful. I had to take arthritis pain formula medicine all the time. I took tramadol, 50 milligrams, every 8 hours through the day and stuff. The pain was just about unbearable. I was looking for anything and everything that might get me through it, short of knee replacement therapy.
How did you hear about stem cell therapy?
From one of your previous patients, Joycelyn, I worked with her, and she told me how good it was. And once I heard about it, then I kept trying to get in touch with you and finally found a flyer to see one of your clinics. And so I came to the clinic and we made an appointment that night for me to come in for a consultation to see about if I would be a candidate for it. And I was very pleased that I did.
So here we are 3 months out from completing treatment. How are you doing? How are the knees? How do you feel?
The knees are wonderful. There's very little pain to speak of. Very seldomly have to take any kind of medication for pain. And where I used to only walk, 200 steps a day, I'm up to 2,000 a day in just this short time. And I plan on moving on and improving even beyond this point.
Fantastic. And so thinking about before treatment and comparing to now, would you say you're 50% better, 80% better, 90% better? Put a number on it.
I put it 90% and still improving.
Fantastic. So having been through it, having been through the regenerative procedure, do you feel like you made the right decision for your treatment?
Oh, definitely. I wouldn't go back and change a thing other than maybe to do it sooner.
Very good. Well, thank you so much for sharing your experience.
You're more than welcome.